Greetings. My name is Nabil Sabai, and I am the program director here at the Henry Ford Hospital Pain Medicine Fellowship Program. I would like to give you a brief overview of our program in preparation for your interview with us. So first of all, congratulations, one, on make the decision of choosing pain medicine as your field, and two, getting an interview offer for our program. One thing I would like to say about our program is that it's very well-rounded and balanced. We have a pretty robust program with regards to both procedural and educational aspect. We have about 6 centers in Southeast Michigan. Our fellows rotate to all the centers, and we usually assign them to some of the more satellite private practice type model clinics, to get the experience of that model, and two, when there's procedures that are not done every day or routinely, that's how fellows get higher on their numbers of more quote unquote exotic type procedures like spinal cord stimulation, stellates, other sympathetic blocks. The main center is in the academic hospital down in Detroit, Michigan, so a lot of the pain clinic rotations will be there. About one thing about the rotations that are required by the ACGME, one thing that we've done here is we have catered them or modeled them in a way that it overlaps somewhat with pain. I'll give you an example. So for the neurology rotation, we have asked the headache specialist in neurology to run that rotation, so it fulfills the neurology rotation, and at the same time our fellows are getting experience with a headache specialist and learning about Botox injections specifically for headache type pains. Another example is physiatry. There are physiatrists in our health system that work specifically with conservative spine, and that's another example of modeling the rotations to overlap more with pain. So it's a much more related and enjoyable experience for our fellows. Also with psychiatry, our fellows rotate with our behavioral health psychologist, as well as Maple Grove, which is the detox center. So they spend a couple weeks there learning from that patient population and the providers there. We do want our fellows to all be involved in scholarly activity, and we do provide time and resources specifically for that. We encourage our fellows to get their idea and their IRB, their proposal approved by the IRB shortly after they start, so that they can execute and complete their research project and ideally publish it upon completion. So with that, I welcome you to the interview process and look forward to meeting with you. Thank you.
Hello, my name is Joseph Hanna. I'm one of the pain medicine staff here at Henry Ford. Together we started a weekly 30 to 45 minutes chapter review sessions. At the beginning of the year, we generally select a concise pain medicine textbook as a source for these review sessions. Each week, one of our fellows is assigned a chapter to review and present to us, and then we engage in a meaningful discussion of this chapter. The main goal is to motivate our fellows to take some time of their busy schedule and busy fellowship year to review the core and the essential topics of pain medicine. We believe that together with our scheduled didactics, daily feedback and teaching that happens every day in the pain clinic, are all contributing to the education for our fellows and their preparation for the IT exam and the actual pain medicine board. We saw how all these efforts were in turn reflected in their ITE scores and the passing rates of our fellows to the actual pain boards. So far, the feedback that we got from our graduating fellows were all in favor of these sessions. So we are continuing them, and we hope to see you soon.
Hi, I'm Dr. Zador. I am the director of the Multidisciplinary Pain Institute here at the Henry Ford Pain Clinic. And we have a team-based approach for the treatment of high-impact chronic pain. As a fellow, you'll be exposed to a multidisciplinary approach to the treatment of complex pain. We look forward to working with you.
Hi, I'm John Dooley. I'm the clinical psychologist with the pain clinic here. We have a multidisciplinary clinic. I see people for a combination of pre-procedural evaluations for spinal cord stimulators, ketamine infusions, as well as for ongoing pain management psychotherapy. The fellows will have the opportunity to be involved in those evaluations, to sit in on some of the therapy, and to get an idea of the psychological implications of living a life with chronic pain.
Hi, my name is Kafaya. I'm one of the nurse practitioners here at the Henry Ford Chronic Pain Multidisciplinary Pain Clinic. We work collaboratively with the physicians to facilitate patient care. Our physicians have multidisciplinary background. They're anesthesiologists, physical medicine and rehab, and pain psychiatrists. I hope you found this video informative, and welcome to Henry Ford.
My name is Roger Haddad. I'm senior staff anesthesiologist, pain physician, currently with one of the graduating fellows, Dr. Patel.
Hello.
We're going to give you guys a little tour of the Pearson Pain Clinic, where we do some of our procedures like spinal cord stimulators. Dr. Patel just finished his final one before he graduates. I am a recent graduate 5 years ago from this program, and I can tell you this program is one of the best programs in terms of interventional experience, as well as clinical knowledge that you can receive across the country.
Hi guys.
Dr. Patel, he's graduating and going to a private practice. Today we performed a spinal cord stimulator. It's kind of bittersweet, as the last time his first spinal cord stimulator was with me 9 months ago, and today he performed his final one and was able to do it all solo without any intervention from myself. In addition to any of the basic procedures that we do, I also do perform sympathetic blocks, cervical transforaminals, celiac plexus, splanchnic nerve blocks, trigeminal nerve blocks, stellate ganglion, as well as spinal cord stimulators, as well as kyphoplasties. Just to give you an example, this is one that we just performed today, which were 2 leads, and Dr. Patel did a great job, and we hope for all fellows at the end of their graduation to be able to perform these at the caliber level as any of their senior staff. We just want to give you a little tour of the Pearson Pain Clinic. Behind me, you'll get to see all the rooms that we have here. Currently now we're in between cases. All right, so we hope to see you guys soon. Unfortunately, we won't be there in person, but if you need anything or if you have any questions, please reach out with Shatoya, and she'll be more than happy to give you my email, and we'll answer any questions that you may have.
Hi, I'm Patrick Forrest. I'm one of the interventional pain staff here at Henry Ford Hospital. And first off, welcome. And I'm happy to meet you guys here coming up for interviews. But I wanted to say a little bit about what I specifically do, as we all have our niche as far as attendings go here. My niche is probably the more advanced interventional procedures, such as kyphoplasties. And I'm happy to report that we were just approved to start doing mild and osteocool here. So I look forward to meeting you all and possibly discussing these procedures during our interview session. Thank you.
Hi there, my name is Adnan Hussein. I'm one of the pain staff here. I also do a lot of regional and OR anesthesia, so a very varied practice. I'm excited that you guys are all considering Henry Ford. This is an excellent program. We do all the bread and butter stuff, and on top of that, a lot of advanced procedures also. Very early on in the fellowship, you'll be doing medial branch blocks, cervical medial branch blocks, epidurals. And we also have faculty that do kyphoplasty, which I recently got trained on. This is an excellent fellowship, not only for the procedures, but also for the didactics and the medical knowledge you'll gain here. You'll see excellent acute pain management and a very diverse patient population here in Detroit. I'm excited to hopefully have the opportunity to work with you guys, and congratulations on choosing pain as a fellowship.
Hello, my name is Sarah Money, and my clinical interest is interventional cancer pain within the Henry Ford Pain Division. In my opinion, the best thing about this fellowship is that it is fully integrated, and what that means is you're going to get the full breadth of pain training from the attendings within this division. We have neurology, physiatry, psychology, and anesthesia all within the division. And this provides a good comprehensive approach to pain management. And your training is going to be complete after this fellowship year. I hope you've enjoyed these videos, and I look forward to meeting you at your interview. Thank you.